In this course, we will explore the use of informatics and technological tools that facilitate clinical practice and patient education and monitoring. Among the topics we will explore are the use of evidence-based practice monitoring tools and ethical aspects of the use of informatics to support patient care. As you read the textbook chapters and other assigned readings, reflect on how the information can be applied into clinical practice and why this information is important to nurses in any practice setting. Clinical informatics is a broad term that encompasses all healthcare and medical specialties. Clinical informatics addresses how information systems are used in the day-to-day operations of patient care. The domains of clinical informatics include the health system, patient care, and the information and communication technologies used to provide that care. The purpose of clinical informatics is to improve patient care with the use of technologies developed from computer science and information science. Clinical informatics has a key role in bedside care, billing, and the flow of information between everyone involved in patient care across large or small healthcare systems. Clinical informatics can also be used to evaluate the outcomes for groups of patients, for example, heart failure or diabetic patients or other chronic illnesses, or to evaluate the efficacy, the ability to achieve the desired effect of programs such as influenza or fall prevention initiatives. Clinical informatics systems are particularly helpful to the elderly who may have multiple providers providing care for a variety of chronic conditions. Data includes the values or measurements and information that is collected to gather information, including patient demographics, images, or vital signs. Information is structured data arranged in a meaningful and understandable way. An example is completing the nursing flow sheet. Knowledge is information that has been synthesized so that relationships are identified and formalized, such as the use of a Braden or Morris Fall scale or the use of a clinical decision-making system. Wisdom is the proper use of knowledge to solve problems and to continuously improve, such as evidence-based protocols and updating of procedures. Technology is integral to effective healthcare delivery for healthcare providers, clients, and in all healthcare settings. Nurses must be familiar with the use of various technologies, including e-health, telehealth, the use of data to evaluate care, and health literacy as it applies to patient education. Nursing informatics as a specialty began with the work of Harriet Worley, who was a nurse researcher at Walter Reed Army Research Institute and was a member of the team that began exploring how computers could be useful in improving health care. She later helped develop informatics as a nursing specialty. Dr. Patricia Abbott continued the work of Harriet Worley and was a key member of the group of nurses who wrote the standards of practice for nursing informatics. She helped develop the first nursing informatics certification exam that is administered by the American Nurses Credentialing Center. Roy Simpson, an informatics nurse, was the vice president of Cerner Corporation, who helped develop the Nursing Minimum Data Set, which helps categorize computer patient data into a usable form. Simpson was also instrumental in developing online nursing administration and nursing informatics master's programs. Fragmentation creates challenges for healthcare providers. Fragmentation increases patient risk in several ways. Chronic conditions increase the risk for complications. Initiating referrals and follow-up by providers is often complex. Increased expense when care for chronic conditions is shifted to urgent or emergency departments, and inadequate immunization tracking increases the risk for communicable diseases. Since immunizations must be given at specific intervals and ages to achieve optimal protection, tracking immunizations is a key area where fragmentation places persons and communities at risk for communicable diseases. Inaccurate or incomplete transfer of information from one provider to another can place vulnerable patients at risk of adverse events, hospital readmissions, and death. These gaps in information transfer are particularly challenging as patients move from acute care to a home or to a skilled nursing facility. In summary, the challenges in clinical informatics are to overcome issues where systems do not communicate with each other, leading to fragmented information. If the system is not easily used by the healthcare team, then they will not be used, placing patients at an increased risk. If the system does not alert the user to risk, such as in administration of medications, then errors will occur, which result in poor patient outcomes. The promises of an effective clinical information system include improved efficiency, particularly if resources are limited. For older adults, accurate information leads to improved management of chronic conditions that can prevent avoidable hospitalizations.